Hey everyone, welcome to the channel. Today we're going to be discussing the most common injuries of the knee, and it's a high yield topic that shows up in a lot of clinical vignettes, in shelf exams, and real life cases. So if you're preparing for your step 2 or just starting clinicals, this video is for you, and you'll be learning the classical presentations, the key buzzwords, and how to tell these clinical syndromes apart quickly during exam. So let's get right into it. The first syndrome that we have is the patellofemoral pain syndrome, and this syndrome is more commonly associated with anterior knee pain, which is poorly localized. And the classical clue that's associated with this is that there will be pain on squatting. Also, this is more common in runners and it's more common in females as compared to males. So let's take an example. In this, the patient will most commonly be a young female, 24-year-old woman with anterior knee pain, which worsens with squatting, climbing stairs, or sitting for too long. There will be no associated swelling, and X-rays will also be unremarkable. So this is simply going to be patellofemoral pain syndrome. Next off, we have pes anserinus bursitis. In this, the patient will have medial knee pain, which is highly localized, and there will be point tenderness at the bursa, the pes anserinus bursa. This is more likely to happen in middle-aged obese females, and it's also associated with osteoarthritis and diabetes mellitus. So in this, the clinical vignette will most likely mention like a 55-year-old obese woman who has medial knee pain that worsens when she's climbing stairs. Her exam shows tenderness below the medial joint line, and this is simply going to be pes anserinus bursitis. Next off, we have iliotibial band syndrome. In this, the patient will have lateral knee pain that is poorly localized, and there will be point tenderness at the femoral epicondyle, at the lateral femoral epicondyle. This is also common in runners and in cyclists. So let's say that there's a 30-year-old male training for a marathon. He develops lateral knee pain after running several miles, and he has tenderness at the lateral femoral epicondyle. So this is going to be iliotibial band syndrome. Next up, we have patellar tendinopathy. In this, the patient will have localized pain in the inferior patella, and there will also be point tenderness at the joint insertion. It's also common in jumping sports like volleyball or basketball. Most likely the question stem will be that of a 19-year-old boy who is a volleyball player, and he has pain just below the patella, which is worse when he jumps or when he sprints, and that will be a case of patellar tendinopathy. And last but not least, we have prepatellar bursitis. This is common in patients who have to kneel a lot, or for example, you might have heard of housemaid's knee. So there will be associated anterior knee swelling and tenderness. The clinical vignette might be of like a 42-year-old carpenter who has swelling and pain over the kneecap after weeks of kneeling, and there is mild warmth but no joint instability. So we're going to think of prepatellar bursitis given the patient's occupation and his anterior knee swelling. So this is done, and now we are going to think of what to do when like clinical stem mentions what the location of pain is. So let's just say that the patient has anterior knee pain. We will either be thinking of patellofemoral pain syndrome, or patellar tendinopathy or prepatellar bursitis. In patellofemoral pain syndrome, the patient will probably have pain with squatting. In patellar tendinopathy, there will be pain and tenderness at the tendon below the patella, and it will be highly localized. In prepatellar bursitis, there will be swelling on the kneecap, and there will be a history of the patient working a lot on their knees or having to kneel a lot. If it's medial pain, we are going to think of anserinus bursitis, and if it's lateral pain, simply think of iliotibial band syndrome. So that's our wrap up on overuse injuries of the knee. Let me know in the comments which one you've seen a lot in the hospital, and if this was helpful for you, give it a thumbs up and subscribe for more high yield information and more high yield content every week.